Stop having negative connotations towards PPO insurances. It's everywhere. Patients hate insurance. The doctor hates insurance. And as a result, the team ends up hating insurance. For something that brings in more than half of the revenue of the business operations, you cannot operate from this mentality of negative energy. I am not getting into spirituality here or manifesting something positive or just praying. I'm saying it from my own personal experience of working with PPO insurances in my own practice for the last 12 years. Even today, PPOs still make up close to 50% of my collections. For something so substantial, my negative energy and mentality towards insurances gets directly passed to my team. And that ultimately affects their working habits. I'll give you an example. If I constantly give this impression that insurances tend to underpay or not cover what we expect, I'm normalizing something that isn't true. And then insurance tends to become the initial thought in your team's mind when they're discussing treatment with patients. You know this happens when you leave the room and the patient sitting in the chair starts asking your assistant questions regarding the procedures you recommended. And the next thing you know, the assistant says something along the lines of, well, your insurance doesn't cover that, so this is definitely going to be more expensive for you. And the patient didn't even ask anything related to the cost of the procedure, yet they only wanted to know whether or not they needed this procedure done. And now the only thing this patient remembers, or the only words this patient remembers from the conversation with the doctor and the assistant, are the words, "This is going to be more expensive."